Hey guys, thanks for tuning in. My name is Tony Merwin. In this video today, I'm going to demonstrate a platform that you may have heard about. It's getting around the campfire, known as Sunfire Matrix. We've actually got it white labeled as Your Medicare Enrollment Center. And if you haven't heard about it, it is an all-in-one platform that allows you to shop, compare, quote, and enroll multiple Medicare Advantage and prescription drug plan products in one single environment. Agents are really appreciative of this platform because not only does it simplify their entire enrollment process, but it's really increasing their productivity, making their business more efficient, and ultimately helping them serve their customers better, and therefore, of course, make more money. So stick around for a bit. We're going to show you the entire nuts and bolts of the platform from A to Z, and hopefully you like what you see. And if you got any questions, feel free to contact me. You'll get all my contact info at the end of the video. Certainly happy to help you out if I can. So stay tuned, I'll be right back. All right, guys, thanks again for tuning in. Like I said, I'm going to walk you through the entire platform of Your Medicare Enrollment Center, powered by Sunfire Matrix, show you the basic nuts and bolts of it. Once you have access, all you got to do is navigate to Your Medicare Enrollment Center.com. That'll take you to your main login screen right here, which you'll just log in using your NPN number and private password. And it'll jump you right into the primary dashboard. Now, dashboard is pretty simple. You're going to see four main buttons right across the top. Your search prospects, which is also your customers area. If you do have any prospects that you've been working with, you'll see them already listed right here. You have your quote and enroll button where you can jump right into the plans. Send a scope for obviously sending a scope of appointment. Then you have a reporting tab to look up any enrollments you've done in a certain time frame. You'll also notice right here under resources, a video training center. This will actually take you outside the platform, but it's got a whole bunch of little short videos on some of the individual features, but not the entire walkthrough. So I'm going to show you guys actually how to create a customer, send them a scope of appointment, and then start looking at their plans and some of the different features in there. You'll see a column of buttons on the left as well. These just coordinate with these four primary buttons across the top. You got your prospects and customers, quote and enroll, send a scope of appointment, and finally reporting. So to start off, we want to hit search prospects. If we've got someone that we want to look up immediately, we can just search their name right here and it'll pull them up. Or over here on the right, you'll see a nice blue button that says new profile. So we click that and it gives us the opportunity to create a brand new profile. And once we got all that data inputted, just hit save. So you'll notice now at the top, it shows us that our customer is Johnny Sunday. That's the new profile we created, and we are now working within Johnny Sunday's profile. So from here, we just want to navigate right back to the dashboard. And just like with any good Medicare Advantage sale, before you can actually show them the plan benefits and details, you got to send them a scope. So the first thing we're going to do is just click on the send scope button, and you'll notice real quick, it gives us four easy buttons. We can email the scope of appointment to our client, Johnny Sunday. We can text it to him, which is super simple. If we have a scope that's been completed but not signed off on by us, we would complete that scope. And if for any reason we have a paper scope that we want to upload and save into our repository, we can actually do that right here with this upload scope button. But for our purposes, we're just going to email Johnny a quick scope. We hit the email button. The scope of appointment pops up. And we just pick our different products that we want to select. It automatically populates our info. We just need to add in his address, the initial method of contact. We'll say it was a lead response, some of the plans that we might want to talk about, and then obviously we date the day of the appointment. If for any reason the scope wasn't completed prior to the appointment, we write that in here. And then just like any other scope of appointment, it defines all of the various products that are available down here. We click our email button, and it's going to give you this little pop-up window, which gives you a 6-digit code that you're going to need to translate to your customer, because they will need that code to open up and access their scope of appointment. So we're just going to copy it to make it nice and simple. We hit send. The scope pops out, and let's go check it in the email real quick. Hey, it's right up here at the top. This is exactly what your client would see. All they got to do is click the scope of appointment document, and it's going to ask them for that personal code. They punch it in, hit continue, and it takes them straight into the scope of appointment. They can obviously deselect any of the products that they do or don't want to talk about or hear from you, and then they simply just sign it. If they have an authorized representative, they'll drop that in there. Other than that, all the other information is populated. They can confirm all that. They can read these product definitions and then finally hit save. After they save it, it gives them this nice little message that says we'll be giving them a call here shortly. Chances are, if you're expeditious, you're probably doing this all on the phone with your client at the same time though. Now finally, going back to our portal, we'll see here that our scope of appointment was an email version. The appointment is today. We sent the scope today. And if we just refresh real quick, going back to the dashboard and back into our scopes, we'll also see now that it's populated for signed. Now this means it's signed by the client. It is not yet completed because the agent hasn't yet signed it. So all we got to do is click our little sign button there. Boom, bang, pow. The date is now populated where the agent signed. The scope is complete. And if for any reason we want to view it, we can click the view button. It shows us right there it's a great success. Gives us our scope all ready to roll. If we want, we can even save it as a PDF. If maybe you want to offload it off of your Medicare Enrollment Center and put it on an external hard drive or maybe in the cloud somewhere, you can. But rest assured, your scopes will sit in the platform as a repository so you can recall them if you ever need them. So again, we click back to our dashboard. We can still see that we're still in the Johnny Sunday customer profile. And now that we've got our scope completed, let's check out some plans. So we click the quote and enroll button, and it's going to take us right into all of the plans, where we will now see every single plan that is available in that county, whether we are appointed with them or not, whether we're certified with them or not, etc. So it gives you a chance to see the entire landscape of all of the products that are out there. You'll notice on the right, for those carriers that are not only available on the platform for enrollment, but also the ones that you are certified and appointed for, you'll see a green enroll button next to them as well. Now, real quick on the left-hand panel, you'll see some filters. It defaults to all of the Medicare Advantage Part D plans. But if we only want to look at the Part D plans, we can click there. And again, it will show us every single drug plan that's available in that county. We've got a Medicare supplement section, which is still truthfully under development. It does give you some opportunities for some of the primary Medicare supplement carriers out there, but the platform is still really building this out. So if it were me, this probably wouldn't be my primary source for comparing and enrolling my Medicare supplement products, although you can use it for that. It's just limited in that aspect because it's primarily dedicated to Medicare Advantage Part D enrollments. Going back to the filters, you see your Medicare Advantage only plans, and then finally your special needs plans. You have a few additional filters in here. If we just want to look at all the plans by Aetna, maybe all the plans by Anthem, healthcare services, Humana, etc. If you just want to look at a specific carrier, if you want to look at them by certain premiums, or maybe if you just want to see all the PPO plans that are out there, you've got these nice filters that'll select them out for you. And then finally, if for any reason you just want to look at the plans that you as the agent are appointed with, you can click that button there and it will limit it to just the products you're actually appointed with. So assuming that we want to compare MAPD plans for our client Johnny Sunday, We're going to leave it in that filter, and we're going to look at some of these. Now, right out of the box, it just gives you the basics, right? For example, we're looking at this AARP Medicare Advantage Walgreens plans, and it doesn't give us too much up front because truthfully, we don't have a whole lot of info entered. But we can find doctors right here, and this is good for any of them. When you click this button, it's going to take you straight to the provider search for any of the different carriers that you're looking up. And you can immediately start diving into the different doctors that are available for any of these different plans that are out there. Nice and quick, super simple. If we want to look at some of the basic details of these plans a little closer, there's a details button on the right. Click that. And as I mentioned, it's just going to give you the out-of-the-box plan details or benefit details for this plan. The premium, the deductible, the in-network and out-of-network max out-of-pockets, any drug deductibles, coverage limits, etc., and then all your different benefits for any given service underneath that plan. So it's going to go through in great detail every single service that's out there, the different co-pays for all your drug tiers, etc. And then at the very bottom, it even links you to the plan documents, their star ratings, and their summary of benefits, which you can open up in PDF here. But because we want to make sure we're doing good by our client and doing accurate, let's run back to the main screen here at Back to Plans. And we want to update our customer profile with not only his drugs, but some of his health conditions. So you look on the left here and you'll see this little briefcase with the plus sign on it. That's their medications. We click on that button and it now gives us a chance to start adding in drug names. Now, good news is all we need is the first 3 letters of the drug name, and it will populate a list of all the drugs that match those first 3 letters. So we don't have to be spelling geniuses. Obviously, these drugs have some pretty ridiculous names. This will simplify it greatly for us. We click on the drug we want. It populates the dosage list. Pick the dosage we want, and it will default to 30 pills in a refill for every month, but we can certainly update that as needed. Once we feel like we got this right, we click Add. It refreshes it, and it adds those drugs in. We can also change their pharmacy. So if it defaults to CVS in this particular instance, if we want to change that to, say, Walgreens, simply type it in. And now it's going to update their preferred pharmacy to Walgreens. Going back real quick, the orange buttons right here, if we want to look at the medications we've entered, there they are. We can edit it. We can simply delete it. We can hide that list. And let's add in a few more for grins. And I'm just adding in a few arbitrary prescriptions. You'll notice that as we start adding in the drugs, the costs are starting to change. And if you remember correctly, when we first looked at this, the AARP United Healthcare plan was at the top, but it's going to start auto sorting it based on how we've updated their drugs to the lowest cost to the highest cost. And you'll now see obviously that Blue Cross is showing as the least expensive for them. But let's keep on with some drugs just to keep this interesting. I'm just arbitrarily adding some for fun. And again, if we ever not sure of the drugs that we've added, just click the View Medication button. There they are. We can edit them, delete them, etc. Now we're getting into some pricey stuff. And again, you'll notice the sort list changed and reshifted all the plans based on some of these new items that we put in there. So we got a few fun drugs in there. We also want to update their health. So we can click this little heart icon, and it's going to give us basically 4 options. It defaults to I don't know. But if we want to update it, it gives us 3 options: excellent, good, or fair. And just to show you, for example, if we click the excellent health, it references it as low usage, but you'll see over here on the right how they figure that. So they assume that if you're in excellent health, low usage, you're probably only going to get about 5 doctor visits in the year. You might have an urgent care visit. You're probably not going to the emergency room. You may not even get in the hospital. And you'll probably just have a vision exam and a dental checkup. If you're in good health, medium usage, obviously these numbers go up now, where you're looking at probably 10 in-network doctor visits, maybe even an emergency room and an inpatient hospital stay. Fair usage, now we're getting some high numbers here, where you're obviously getting a lot of usage out of it. Now, when we update any of these health conditions, we're also going to see all the plans shift. So for grins, we're just going to go to a medium usage, hit update. And again, it's going to reshift all of our plans, update them based on that algorithm, and give us the estimated cost right there. And you'll notice it breaks it down twice. It gives you the total estimated cost, the estimated cost of health, so your actual doctor visits, inpatient network, etc., and then also your drug costs. If we want to look at this a little tighter now, we can come back over to the details button for any of these plans. Click on the details. And again, it defaults to the out-of-the-box basic benefits. But now that we have info in there, it adds 2 new columns. We have the drug cost details, which again, that'll show us our total estimated annual out-of-pocket for drug refills. It gives us the status of the pharmacy that we've chosen. It reiterates all the drugs and shows them where they match up on the tiers, if they have any of the other restrictions on them, such as quantity limits, prior authorization, step therapy. It also gives us the full drug cost based on retail. And that's feeding off of good RX's information based off the zip code that you entered and the average retail cost in that zip code. So we can just kind of scroll down and we'll see all these different drugs that we entered in there. And then it will give us the monthly breakdown. So in January, they're going to pay $163. February, $163. You'll see they're in their initial coverage limit here for this plan because it is a 0 deductible. But we can expand every one of these months. And it looks like this person probably is going to pay $163 month in, month out. Oh, they finally hit their gap in October. And so forth. So great info there. It breaks it down nice and detailed for you. And then it also has the health cost details. And this is, again, it's a guess. You know, they're based off an algorithm of medium usage. So they're looking at probably, I wanted to say 10 doctor visits in the year, maybe an ER visit, possibly an inpatient stay. So, you know, there's certainly a good possibility that they take care of themselves. They might not even spend all that money. But based on medium usage, this is the kind of expenses we're looking at. This plan, obviously, because they don't have a doctor cost for in-network visits or a copay, you're looking at 0 there, $90 for the emergency room. There's their 5 days in the hospital, etc. Pretty simple stuff. If we want to look at some other ones, we can go back to plans, do the exact same thing, just click the details, and it'll spit out all of that same information for this particular plans, the out-of-box benefits, the drug cost details, and then, of course, the health cost details there. Now, going back, if we want to look at them in a little different light, we can compare and email a quote of 2 different plans. So all we got to do is check off our compare quote button. We can actually do up to 3. You'll notice I'm populating down here at the bottom as I'm doing this. And we can email that comparison to them. We can compare them ourselves. Hit that compare button and boom, it's going to load them up side by side. Starts with the out-of-box benefits. Then we can look at how the drugs are costing across these 3 plans side by side. And then finally the health costs side by side. Going back to plans. Another pretty slick feature is this eyeball over here. Real quick, let's get these out of here. There we go. And this eyeball is a neat way to look at everything. It's, I guess they consider it a bird's eye view. You click that, and it lines up all the plans over here, and then it gives you their personalized benefits over on the right. Same concept. There's the x-ray of the basics. There's the specific benefit details of that plan, drug costs, health costs, etc. And again, you can just scroll down through the list and pick any one you like and run through them. Pretty slick. Just click the little X'd out bird's eye here to go back to our primary view. And that's basically the gist of checking out all the plans. Now, if we know for a fact which one we're ready to enroll this client in and they are ready to go, there's a couple of things we can do. Number one, if we want, we can go back to the dashboard real quick. We're still working in Johnny Sunday. But let's go to prospects real quick and let's look him up. There he is again. This is the one that we were playing with right here. You'll notice I got a few in there. I've been doing this a few times. But under these little actions, you got a few options. Again, we can edit their profile. We can view the quotes that we've been looking at. All of those drugs and everything we put together for Johnny Sunday is saved. But if he's not ready to enroll yet with us, or maybe he doesn't want to go to this great link with us for any reason, we can send him our personal URL. All we do is click the send URL button. That's who we're sending it to, and hit send. And out the door it goes. Now it's going to come back into his email. Here it is. The 2020 plans. Hey, Johnny, Medicare can be confusing and stressful, but I'm here to help. I will find plans that cover your prescriptions, doctors, so that you have the right coverage while still being affordable for you, yada, yada, yada. Nice little email there. Signs it off with your info, and you hit the orange button for get started. Now, this is your consumer-facing Pearl. Now, you can also save this Pearl to your signature, to your website address, print it on a business card. Probably not that because it's digital, but any way that you want to be able to transfer or translate this to any of your clients, you can certainly do so. You don't only have to send it through there. But this is exactly what your client would see anytime they are shopping your Pearl. They punch in their zip code, he hits see plans and prices, and you'll notice the view is a little different for them. Number one, they can only see the plans that you are appointed and certified to sell. They cannot see all the other products. But the buttons are nice and big. The logos are beautiful. It's pretty simple for them to navigate. And they can even add their own drugs in. When they click the add drug button, it makes it nice and big for them. So pretty simple. They can add the drug, etc., etc. View plans. And it'll update them as necessary. And if they're ready to hit enroll, they just hit the green button and enroll. Pretty simple, follow the bouncing ball. They type their names in, all their details. I can't actually do this for you right now because this is a live app, and I'll get in a lot of trouble with CMS if I enter a fake app. But I do just want to show you some of this. This is exactly what your client sees. You'll notice it is very slick, very clean, very easy for them to use. Matter of fact, I forced my 75-year-old mother to use this platform just to test it out and see how easy it was. She is not very tech savvy, and she had no problem. You'll notice some other nice features. They can also look at the details of the plans, same as you could before, benefits and drug costs, etc. They can compare them, Same thing, they can compare up to 3 plans, look at them side by side. Shows them all the good stuff. And again, the enroll button keeps popping up. So if they find, you know what, I like that one, let's go, let's enroll. Just like I showed you before, just goes right into it. If you need help, if they hit this get help button now, this phone number, it should be the phone number reflected in your profile. So nothing in here will direct them anywhere other than back to you as the agent. Pretty simple. And you can update a lot of this info in your profile. I have it fairly generic for me to take me back to my office number. But again, right up here, if they have any problems, it's going to display the phone number that you want selected in your own personal profile. So that's the consumer side. Going back to our side though, we'll go back into our client Johnny Sunday. We're going to go back into view quotes, and we're going to show you what the enrollment looks like for us. So let's say for arbitrary purposes, he wants to enroll in this one here, this ARP Medicare Advantage. We're just going to click the enroll button, and it's going to load up the enrollment form. A little bit of data entry on your part. Oops. Do they want to receive the plan details electronically? Pretty simple stuff. Every time you come through here, it also populates the summary of benefits to keep it fresh. And also just to remind you that because one of the requirements is to always deliver the summary of benefits with any enrollment, it is automated in your enrollment to your client. So you don't have to go to the trouble of printing one out and trying to get it to them, emailing it to them, etc. It's going to be attached. Now, as we're going through here, if something distracts us, we can save our progress in the enrollment, come back to it later. Otherwise, just hit continue. Apparently, I left something out here. Oh, permanent resident, we're good. Or is it different? There we go. Gives you an example there. Add in all their stuff, and I'm just clicking on some buttons now just to kind of show you how this runs through. Now, if it's an HMO plan, obviously you got to find a doctor. So it pulls up the provider search again. You punch in their PCP ID and name, etc. And this is about the point that I need to stop, because if I get going any further, it's going to become too far into a live enrollment and I get something transmitted to CMS that we don't want to do. But once you hit continue here, there's a couple of final questions on their Part A and B effective dates. You hit continue and submit, and it will be just like the scope of appointment. When you hit submit, it's going to give them a 6-digit code. You email them or text them the enrollment confirmation, just like we did on the scope of appointment. They'll punch in their 6-digit code, confirm a couple of radio buttons. For example, their LIS subsidy option gets confirmed. Their Part A and B effective dates get confirmed, and then they simply type in their name. Done deal. Super easy. When you're done, you can come back to your dashboard, check it in reporting, and you'll look up today. If this was an enrollment that we had completed today, it would populate right down here. So pretty simple system. That's really the gist of it from front to back, you know. And like I said, there are some short videos here in the training center. Everything you need is all self-contained. In my mind, this thing blows any other enrollment platform out of the water. So I really appreciate you guys taking some time to follow along with me. If you got any questions on the platform at all, look me up on Facebook, give me a call or shoot me an email. You can always reach me by phone at 800-998-7715. Thank you guys again for tuning in. I really appreciate it. I hope you got something out of this. You know, in my mind, it is the easiest platform out there for this purpose. If I can help in any way, just give me a call, look me up on Facebook, or even just shoot me an email. Hope you guys have a wonderful day, wonderful night. Stay safe out there, and I'll certainly see you on the flip side.